Where are we on SARS-CoV-2, and where do we go from here? What's next? Hello everyone, this is Dr. Chris Martinson with your update on SARS-CoV-2 for August 6, 2020. I'm going to call this one the XYZ theory explained. And first, hey, a mea culpa. I know that I confused a lot of you with my presentation from the 4th. Hey, I'm really sorry. I think I can just chalk that up to the fact that I just did a terrible job of explaining and laying out my case. One of the things I do pretty routinely is I make big jumps in my thinking. And listen, I think I just made too big of a jump that time for a lot of you. I get that. And here's the motto I kind of live by. It's a great reminder. Albert Einstein said, the important thing is not to stop questioning. Curiosity has its own reason for existing. I'm a very curious guy, no question about that. But I'm going to keep questioning this particular virus, and we're going to keep coming at it. It's novel. We haven't faced anything like that. And so just to clear up any possible confusion, let's review this thing right now. Okay, where are we? First, SARS-CoV-2. It's extremely harmful to health for those that get hit by it. And it's a very, very big number of people, either mild cases and certainly the hospitalized cases, to say nothing, of course, of the people who die. It kills and it maims. A lot of people, looks like, are going to have long-term consequences from this. And this is just on the first pass. Look, we don't know. We don't know if it's going to come around again. The long-term effects, they look crappy for many, far too many. It's an awful disease. It really is. And I'm pretty certain it's unnatural. It hits too many receptors. It hits them too well. And therefore, it has too many effects on too many organs. It's got terrible impacts on the lungs, kidneys, heart, and brain, possibly the testes, possibly other, maybe your entire vascular system. We don't know. It's pretty bad, but it seems like every day there's just more and more confirmation of the fact that for those who get hit by this thing, it really just rampages through their body, which means I don't want to catch it ever. But that's presuming I haven't had it or been exposed to it. I simply don't know because so many people get exposed to this thing and are completely asymptomatic. It's pretty close to half by 40-45% are the numbers we have that are completely asymptomatic. All right, so we don't know what to make of that yet. Up to this point, all of the social distancing, all of the lockdowns, all of the restrictions, the mask wearing, all these efforts up to this point were absolutely essential for all the reasons we've been covering these many months. We needed time to get our hands around how to treat this thing. We know a lot more now. Oh my goodness, if you go into the hospital today, you have such a better chance of coming out in a better condition or even alive compared to if you went in February or March, back in the bad old days of just plunking people on ventilators. So yes, this was essential. And guess what? We're going to learn more as time goes on. Now, here's the other part of this argument I was trying to get forward on the 4th, on Tuesday. Some countries have been successful at containment and tracing. Others, like mine, the United States, unable to do that. Just a terrible job. Can't do it. Culturally, politically, something. Or there are other countries don't have the resources to be able to do that. Maybe, I don't know, Haiti or Pakistan or something like that. So some have been successful at containment and tracing. They have a very different path before them than the countries that have been unable to do that. So these are two very different sets of countries at this point in time. We have now bifurcated into two worlds. There are those countries, New Zealand, South Korea, Taiwan, China, that have gone really hardcore and managed to, they did what should have been done right from the beginning. You halt all inbound infections, you put masks on everybody, then you have very aggressive contact tracing and quarantining, all of that stuff, and you can just absolutely crush this thing. Now, that gives them a very different path going forward because as well, remember the first step in that? You got to halt the inbound infections. They can't allow those inbound infections to come back in because they, in many respects, still have what's called a naive population, an immunologically naive population that hasn't really been exposed to this thing yet. Pockets have, certainly Wuhan has, but Greater China has not. Beijing, still very much a naive population there if they've been honest with all of their numbers. And I think they mostly have around that. I believe we would have seen lots of impacts if Beijing had been swept by the coronavirus. I think we would have seen, the usual stuff, bodies in hallways and maybe the crematoriums running 24/7, that kind of stuff. We didn't see that. So at any rate, I would put China as a country that's been very successful at containment and tracing. And, when Wuhan just had a resurgence of a few hundred cases, they tested all 11 million people in the city. I mean, it's just astonishing, right? And you got Trump crowing about the fact the United States has run a few million tests, right? It's just different scales, different orders of magnitude, all of that. But some countries, they do that. Others haven't. The countries that haven't, this is about talking about being curious. Let's be curious about what actually might have happened here and what's going on in these countries. This would be all of Europe. This would be India. This would be South America, the United States. Every country that has not managed to have a successful contact tracing and containment strategy. All right. At some point, though, we're going to have to realize that lockdowns do more harm than good, right? We can't stay locked down for infinity. We can't stay locked down for the next 1,000 years. There's going to be some point at which we either have such a good handle on how to treat this thing, or we think that maybe some level of herd immunity has been reached, that lifting the restrictions on gatherings, restrictions on what kind of businesses can be open, restrictions on things like even schools opening. All right. So that's the review. That's where we're at. And remember, I've always been talking about SARS-2 as a balancing act. You stop the pandemic, you got to get that R0 below 1. A bunch of countries have done that. You do that with your non-pharmaceutical interventions or tight containment and isolation actions. Those are the things you have to do. Non-pharmaceutical interventions include masks, social distancing, things like that, okay? And you absolutely want to keep the hospitals working, which means you need to keep the infection level below that which swamps your hospitals, right? As soon as you swamp the hospitals, very bad, because not just COVID patients getting substandard care because all the doctors, nurses, and ICU beds are full and worn out and all that, but other people who have other conditions like motorcycle accidents or heart attacks are getting substandard care because the system is crushed and overwhelmed. So you want to avoid overwhelming your healthcare system. In between those two, we have keeping the economy going, which if you don't keep the economy going, you're going to have just as bad an outcome. I don't know if your whole economy really crashes, maybe people starve. For certainly people who have loss of income have a lot of stress in their lives. Stress weakens your immune system. As well, we know that it weakens your mental well-being. Suicides really skyrocket during periods of time when people lose their jobs, when they hit poverty, things like that. And so obviously keeping the economy going is essential as well. So this is the balancing act. The argument I'm going to put forward here today is we're going to talk about a theory. I'm calling it the XYZ theory. It'll be obvious in a minute why that is. And it's going to ask the question, is it time in some places to consider lifting the restrictions or not? And here's how this theory works. First, how do we explain this? So here's a series of charts, and you can see how they all follow this case progression that kind of looks the same, right? All these little lumps and humps. They very quick rise in cases and then an equally quick decline. So this is the UK, Italy, Belgium, Turkey, Germany, Pakistan. Those are all the ones you see in colors here. So regardless of, Pakistan seems to be having exactly the same sort of a case experience as, say, Germany. But, just delayed a little bit. They had a slower start, but then when they hit their explosive case, cluster, boom phase, the boom phase looks a lot like Germany's boom phase, right? And then an equally quick decline. Almost identical charts. Now, how do we explain that? How do we explain that? All right, couple of ways. I gave short shrift to this other explanation. In fact, I don't think I talked about it at all. So a lot of you pointed this out. So let's take this one. Theory 1. Here's how we explain all these similar looking curves. First, each country on this chart has implemented equally effective NPIs. That's distancing, it's the lockdowns, restrictions, mass testing, all that stuff. So whatever each of these countries has done, they've been equivalent. And they've managed to give the same sort of identical looking chart shapes, whether it was Turkey, whether it was Pakistan, the UK, Italy, Germany. Obviously, very different cultures, very different resources, very different approaches. Every one of them tried slightly different things or vastly different things, depending. And yet we got charts that looked kind of the same, graphs that looked kind of the same. Case, cluster, and then they went away. The case counts went down. So that opens up a second theory, which is which is absent complete control over the virus, a la China, Taiwan, New Zealand, so forth. The virus overwhelms a country or region, it romps through, and then is largely done. The first wave is the largest and the worst. So this was the theory I was putting out. It's just an idea. Remember, we're just going to remain curious. We're just going to have an open mind around this stuff. We're just going to say we're going to question this, because there's one point of view that says, okay, theory one says we've put these NPIs in place, we've managed to get this thing under control, and if we if we let off just a tiny bit, what's going to happen is this thing's going to come roaring back. You're going to see a second wave. A lot of people said, hey, this is going to be just like the Spanish flu in 1918. I don't think so. I don't think so, and I'll tell you why. A, we know a lot more about viruses and things today than they did back then, and we have got advanced capabilities of tracking and learning about this stuff and educating each other and all that stuff. B, it's a very different virus. Coronavirus is very different from an HN series influenza virus. They have entirely different sort of life cycles and all of that. And so I don't know that we can say because there were successive waves during the Spanish flu pandemic, we're going to face successive waves this time. And it might also be the case that that this coronavirus is just going to behave completely differently, that it doesn't have a seasonality, that, in fact, I think the data shows that it spreads in countries that are warm and just as well as countries that are cool. We think that part of the reason that we saw different experiences at country levels is because there were different strains that went around. But certainly the D614G mutation, the strain that swept across Italy, that's the one that I think we're going to say is the one that's dominant and really sweeping the world right now. All right, so let's go in on this. Let's go in on the XYZ theory on herd immunity and ask the question, this is the kind of thing you would see here in a shape like this if herd immunity is hit. It's here you see as the virus is ripping through a population and then it's finding fewer and fewer susceptible hosts over time. And that would explain this chart. So would theory one. They're both equally valid. We don't have great data for each right now, but if the XYZ theory is correct, then we could make an argument to say, well, let's start releasing a little bit of the containment, stopping the pandemic so that we can keep the economy going. It's asking for a little bit more of a balance between these two right here, as long as we keep an eye on this one over here. All right, let's look at the XYZ theory then first. X% of the population has pre-existing immunity. We don't know why. They just do. Possibly cellular or T-cell immunity. It's either full or partial immunity. Full immunity, totally asymptomatic. We can do a PCR test and say, wow, this person is full of the virus particles, but they don't even report any symptoms. Nothing seems to have happened to them. Totally asymptomatic. Or partial immunity, they get these mild cases. So this is possibly or probably due to prior exposure to other common cold coronaviruses. So your body's already seen a coronavirus. It doesn't have the antibodies to it, but it does have this T-cell immunity. And because your body saw the same region of the coronavirus common cold you're fighting, it recognizes SARS-CoV-2 right away. It comes in, it's like, oh, I've seen this before. Deals with it, no problem. All right, what's Y then? Y is Y% get exposed, but then they don't develop antibodies. For whatever reasons we don't know yet, their bodies go down a T-cell immunity or other cellular immunity pathway. That's where they go. These two, probably the mild cases, we're guessing. And the reason we're guessing that is that when they looked at people who'd been hospitalized with serious cases, they saw antibodies in vast majority of those. Varying degrees, some of them had pretty light levels of antibodies, but the more serious the case was, the more antibodies were detected on a tighter level. So that's what the data says so far. Again, we're going to need tons more data to really firm that up. That's what we're seeing. And then Z, well, Z% of the people develop traditional B-cell mediated antibodies, the humoral response. And so far, we're seeing this hang between 10 and 20% in all the places that have been looked at, like London, Madrid, New York City, stuff like that. We did at our site, commenter Tata Girl pointed out that they're in in the slums of Mumbai, they found a place with 57% seroprevalence, and that was across a couple of thousand tests that were run. I'd love to see that repeated. That's the highest seroprevalence we've seen. That would cause me to change my thinking on this theory a little bit, but so far, every place that I've looked that we've seen that's come back with the data says 10 and 20% seroprevalence. And you could imagine if you said, well, we need to see, 75, 80% seroprevalence. That's where herd immunity is achieved. It's something like 80% of the population has immunity. That's where you get herd immunity. Then you wouldn't expect to see theory 2 is complete junk if you're saying that 20% seroprevalence is all we've got, because there's no way 20% seroprevalence is going to stop this honey badger virus with its R naught, a native R naught of, I don't know, 5.6 or something like that. It's pretty high. All right. So, but somewhere between this percent of people and the Y percent of people and the Z percent of people, X plus Y plus Z gives us our herd immunity. So here wild guessing time. You ready for some wild guessing? Here's some wild guessing. How about this? What if we said X percent of the population, pre-existing immunity? And by the way, the very young could fall into this camp. That's, let's call them prepubescent, under the age of 12 or so. They just don't seem to be impacted at all. We don't know why yet. They're full of virus particles, but, we can, who knows? So at any rate, whatever the percent of the population that has this pre-existing immunity, we don't know why, but there it is. Is that, I'll just make a number up. What if that was 30%? And then we know a bunch of people, they get exposed, but they don't develop antibodies. We know that there's a whole bunch of asymptomatic and mild people. In fact, that's the vast majority of people. Asymptomatic at about 45%, mild cases running all the way up to about 85 or 90% of all cases that are symptomatic are still mild, right? And so I don't know, is that 40% of the total population? And then we know some percent develop traditional antibodies. Let's go in halfway in between 10 and 20%. Let's call it 50%, 15%. So what does X at 30% plus 40% plus 15%, what does that give us? That's 70, 85%. So would we have herd immunity if this X plus Y plus Z was happening? Yeah, we would. And I just made these numbers up. I don't have any great solid data for these, but we got to know that X percent of the population has this pre-existing immunity. Is it 30%? Is it 3%? We don't know yet, but it's a number higher than 0. That's for sure. Y percent, we know they get exposed. We know they don't develop antibodies, but they have immunity, either partial or complete. Is it 40%? Is it 60%? 20%? We don't know. These are just numbers. It's just a theory. We're just being curious here. We're just throwing this out. And so that's what we're seeing. Now, when I look at the macro data, though, so a lot of people say, well, Chris, that we're not testing as many people and we have very incomplete testing and, we don't really know how many people are actually infected. It could be that a lot more people are infected than we suspect at this point in time. That's why we go to the macro data. So 3 big pieces of macro data. The first you might ask is, hey, are our hospitals overflowing? That would be a great thing to know. And the first is we would say, well, here for the United States, this is estimates for hospital bed occupancy. This is percent of inpatient beds, not just ICU, but all beds occupied by COVID-19 patients. You can see here across the southern states all these areas that are having a lot of trouble with COVID right now because they're just on their first big wave of this. New York, look at this, 0 to 4.9%. Massachusetts, I'm living in Massachusetts, we had a hotbed. All of New England, 0 to 4.9%, right? Remember, Seattle was one of the first places, it had the first case actually, the very first sentinel case that was identified in the United States. It's sitting here at 0 to 5%, right? The worst of them all is New Mexico here. I think they're about 27% right now of all inpatient beds are occupied by COVID-19 patients, but everybody else is down here at this area. So the second question is, well, that doesn't really tell us much. What's the percentage? Are we filling those? Are we getting more and more of these patients or not? So the question is, are the bed counts rising or not? I think we can clearly see that bed counts across the United States are currently falling. They could start to rise again. We don't know. The case counts, certainly there's a lag between when people get exposed to and develop symptoms for COVID-19 and when they would end up in the hospital. So it's possible that we could see this rise again, but for now, in the United States here, we see hospital bed counts are falling. And then the biggest piece of data, the macro data that we would have, is excess mortality. Is it rising or is it falling? Here we can see the great flu pandemic, 2018. You remember us all talking about that back then? Yeah, me neither. Nobody talked about it. It just sort of happened. And here's the other one from, you can see this little red dot right here. There would have been a little cluster of those as well. So what we're looking at here is excess mortality. If you're above this orange line, they're going to call that the threshold for excess deaths. And the predicted number of deaths would be these blue marks right here. And so what we're actually seeing right now in the United States was the big spike of deaths that happened back in March and April, and we're still above the line, but not appreciably more above the line than what you would have seen for flu back here in 2018. So yes, there are excess deaths, but we are not. What are we not seeing right now? We are not seeing this in the United States so far. So that's the macro data that says, look, if we can't really trust the case counts, if we can't really trust all of that data, I can trust the excess mortality data. And by the way, it's not just the case in the United States. We see the same thing is true in Spain. We see excess deaths here went up and then down, and Britain up and then down, Belgium up and then down, Italy up and then down, the Netherlands, France, and Portugal all went up and then down. Maybe Portugal's got a little uptick right there. And what's interesting about that, when we look at this and compare this to NPIs, if we look at, for instance, the percent of population wearing face masks in public as of the 5th of August, I don't know how they get this data, but this came off of Wikipedia. Hey, I'll still go to Wiki from time to time for a table like that, even though they took my webpage down for all of this reporting. At any rate, well, look at this. So look down here. Look at Denmark. 4%. They're at the 4% are wearing face masks, and somehow, what are we not seeing in the Netherlands is just not a lot of cases going on here. France is hanging out way up here at 83%, and they've got a big fall off here. Italy clocking in at 81% people wearing face masks, and they saw the same behavior. But I went through a lot of this data, and I couldn't find a ton of correlation between the shape of this spike and whether or not your country was undergoing a lot of complex NPIs, non-pharmaceutical interventions. But obviously, people change their behaviors when they're confronted with this thing. I certainly have. Maybe you. I bet you have as well, right? So we keep our distance a little bit more, and all it takes is a little distancing. That even just that 6 feet, I think, is a really key thing. Washing your hands, key thing. Just being alert about where you are and not touching things in public and then touching your face. Many of us are a lot more alert to that. Those are the things that really have a super big impact. But at any rate, what we're not seeing right now in Europe is a lot of excess deaths. In fact, many of these are below their actual long-term trend. So they're actually experiencing fewer excess deaths than normal. Why? Because, well, as we've talked about, people are not out traveling around doing risky things. And so that's led to fewer deaths in some cases overall. All right, these countries, I'm going to guess, according to the XYZ theory, aren't entirely done with the first wave. The United States seems to have peaked over at this point in time, but you can't look at the United States as a whole. I believe New York has had their first wave. Texas is having their first wave. Florida is having their first wave. New Mexico is having their first wave. Things like that. Even within a state, California, there might be areas that are having their first wave and others that have been past their first wave, if the XYZ theory is correct. India here is still very much on the upswing. Brazil still very much on the upswing here. Colombia seems to be taken off this way. And then in the European Union, we are seeing an upsurge in cases right here. But again, this is for a couple of key regions, and one of the bigger ones is Spain. And a number of you said, "Well, hey, I think Spain invalidates your theory." I don't think it does, and here's why. Yes, we are seeing another round of cases here right now. We would presume that maybe deaths might fall a little bit, but as you can clearly see, deaths have fallen off tremendously here. So How do we explain this? How do we explain this if we think that Spain had a first wave and then they dealt with it? Shouldn't they, Chris? Shouldn't they be on your XYZ theory? Aren't they past that? And the answer is no, because Spain is a big place. So if we look at Spain, what we see is that here in the central region around Madrid, the big cities, they hit very high levels of seroprevalence. Again, 10 to 15%. But look at this region out here. 5%, 4.7, 4.9, 2.9%, very low levels of seroprevalence out there. These are the areas where they are now seeing the uptick in cases per 100,000 of population. This is where the current outbreak is happening in Spain, as far as I understand it. So this actually fits with the theory. It says that until you get to numbers that look like these over here, you haven't hit your immunity threshold. Not because 15% is a magic number for seroprevalence. It's because by the time you get to 10 or 15%, these other numbers have also had a chance to fully catch up, and because of a full exposure at that point in time. That's the theory. All right? That's what it looks like. If the theory is valid, then we won't really see a second wave coming along in places like New York State, which have already gone through. And again, New York State might be a tale of many places. Maybe this New York City is different from Rochester. I don't know, right? But just sort of looking at it as is, the theory would be that we wouldn't see this. And if we do see that, then the XYZ theory is complete junk, and we can toss it away. But hey, that's how hypotheses work. You form them. You try and fit them to the data, you see what the data does, and if the data comes along and wrecks your theory, you know what you do? Change your theory. That's how this works. All right. Same thing. We might say maybe London has achieved herd immunity, but certainly not other areas. We know that there are other areas of England that are now currently under lockdown, in the Midlands, other places here that didn't really achieve lower levels of seroprevalence. They were only at the 6.5%, 7%. Maybe that wasn't quite enough. Maybe you need to see something around this level. That's the theory, okay? Just a theory. I'm going to hold it lightly, and I will let go of it if it turns out not to be correct, because that's how I roll. I'm just going to keep being curious and see what happens. And so the main hypothesis, again, is that because of this really high R naught, only very determined countries can actually stop the honey badger virus, right? Full contact tracing, quarantining, really aggressive measures to make sure that every single case, you don't just find the case, but all the cases that other places that case might have been spread to. The rest of the countries, like my own, who can't seem to do that kind of stuff, it's just going to burn through their population in a primary wave. Now, the shape of that wave and the duration are determined by your NPI. So you absolutely don't want to overwhelm your hospital system. You absolutely want to give yourself as much time as you can so your country, your region, your hospital system can catch up and learn the latest and best ways to deal with this thing. You want to educate people about how to prepare their terrain and get their immune system tuned up, because it's very clear right now. Again, we don't know what the actual numbers are right now, but we know that some number of people seem to have pre-existing immunity. Is there anything we can do to help encourage that? Well, of course there are. Vitamin D, for starters, right? Which, I'm only continuing to push that. There are other ones that I think are equally valid. But that one, why? Because we've got a lot of science and science papers that support that. But zinc as well, and a way for that zinc to get into your body, quercetin, things like that. All of these things matter. So that's why, when you're back here on this theory, the shape, yes, and duration of that wave determined by the NPIs. I think anything we can do to buy time and not let this romp through our population is great, but it is going to romp through your population unless you are out there very aggressively contact tracing and isolating and quarantining and doing all of that. My country isn't doing that. So I think that explains what we're seeing here. But again, just a theory. Herd immunity, it happens pretty quickly, and at about approximately 15% seroprevalence using current antibody tests? Question mark. It's a theory. It's a hypothesis, but it's one that kind of fits with what we're seeing up here. Of course, it could be that this is entirely due, all of these shapes of all these charts across all these different countries is simply due to the NPIs, the social distancing, the normal behavior of humans when they see people around them getting sick. But again, these countries are so different in terms of their cultures, in terms of their resources, in terms of what they can and can't do from a medical standpoint. Pakistan and Turkey and Germany and Italy, really just not a lot in common when you look across all of them as a whole. All right. Carrying on then, as I put these numbers out, remember, I think these are unreasonable numbers in the sense that too many people come up with long-term issues off of this. Everybody who has symptoms with COVID seems to have some measure or level of, or far too many of the people who have symptoms, I should say, have some level of measurable impact days, weeks, months later. We don't know if they're permanent or not, but it's too much. Too much, I think, with people coming up with long-term health issues for the United States with 320 million, 80% times 45% times, say, 10 to 15% gives you 17 to 25 million people with long-term health issues. Unacceptable, unreasonable. Let's not do that. So in my world, there is a path forward, and it works like this. Step one, everybody prepares their terrain. We do this by taking vitamin D, we're eating healthy, we're sleeping well, and we're avoiding stress. All things that are known to help modify and boost your immune system. Those are all things everybody should be doing. Why we don't have national health ministers or their equivalent out there talking about step one is, maybe that's a subject for a whole entire video at some point in time, but it's criminal as far as I'm concerned. It's certainly amoral at best, immoral at worst. It's indefensible. It really is, because we know that one of the best things you could do, the cheapest things you could do, the most efficacious things you could do from a time, money, implementation standpoint is get out there and just encourage everybody to go out and take vitamin D, eat healthy, sleep well, avoid stress. Boy, if you could do those things, this would be a very, very different outcome. All right? Boom, done. If I was going to say do one thing, I'd do that. Number one. Two, everybody wears a mask, practices social distancing, and gets tested if or when they're suspicious of exposure or illness, right? So you got the symptoms, or you're worried that you were around somebody who had the symptoms, or they have COVID, all of that stuff, all right? So boom, you get tested immediately. All at-risk people take extra precautions, all at-risk people. So if you have the comorbidity, if you're beyond a certain age, or both, if you have an immune-compromised situation, if you're a double lung transplant, patient in the past, whatever, all at-risk people take extra precautions, and all of us who aren't at risk take extra precautions around those people with and for them, right? That's what we would do in a healthy society. All right. If exposure or illness is suspected and caught early, HCQ+, the plus stands for zinc, and azithromycin is administered within 2 days of symptom onset. That's what the data says. If you do that within 2 days, very awesome things happen. I'm going to present a lot more of that data later. I know some of you have said, God, can you just stop with the hydroxychloroquine stuff? I'm like, no, it's an effective thing. It seems to work. Anything that's effective. And it could be that we have many other things that come along that are cheap, effective, easy, can be administered on an outpatient basis, all of that stuff. That'd be fantastic. So, but what happens if that doesn't work? Because it doesn't always work. It doesn't work 100% of the time, but it works maybe, I don't know, half the time or something, or whatever the numbers are. All right. What if that doesn't work? Well, then if the symptoms progress, then you go to the math plus protocol with the M and the H, the really critical ones here. Methylprednisone and heparin, right? So the biggest thing that we're seeing is all those microclots, the thrombi, the clotting that goes around and destroys the microvasculature with little clots and creates ischemic or loss of oxygen moments to maybe parts of the brain, parts of the kidney, parts of the heart, all that stuff. So the heparin's really important. Thin the blood, keep those clots down. I think the Math Plus protocol has just fantastic results on it, and that's the one I would, if I was looking like I was progressing, that's one I would absolutely ask for in my own personal case. And then if the symptoms get worse anyway, well, then there are advanced therapeutic support things that we can do out there. There's much more expensive monoclonal antibodies against IL-6, one of the interleukins, and there's other things that are showing up pretty well right now. I haven't had time to review all the new advances that have come out. There's some sort of inhaler that seems to be doing a pretty good thing with a certain type of a steroid in it, on and on. Lots of things are happening right now, but this is sort of the progression for you would go forward. It's not like you catch it or you don't. It's you start way up here and you say, A, I'm going to try and make sure that I'm asymptomatic. And then B, we're just going to make sure that if we do get it, remember when you wear the mask, that means you probably got a lower viral load. You're going to have a better outcome of this. And social distancing does the same thing. And all at-risk people have taken extra precautions, all of that stuff. But then if that fails, well, then we got this first thing you do, and then we've got this second thing you do, and then you got this third thing you do, right? And that should be how we're dealing with this. All right, so conclusions and summary for, I did it again. It's the 6th. All right. First, we still don't know a lot about SARS-2. This is a novel coronavirus. That's why we're going to sit here and be as curious as we can and not stop questioning anything, because it's still novel. We're learning a lot. We don't know a lot yet. What do we know? Well, we don't even know how many people have had it. We don't know why so many are asymptomatic. We don't have a clue about that. We don't know if immunity persists. We don't know if the curves came down in all these different countries because of NPIs or because this thing burned through, because the XYZ theory worked out. We don't know. We don't know any of that. So given that, we know that SARS-2 is exceedingly difficult to stop. Now, it can be done, but only with full dedication. But that leads to a different sort of a set of issues for you, right? So let's imagine we're New Zealand. We've got all the cases. We've managed to control our island nation. Yay. Now, if anybody wants to travel to us or our own citizens want to travel away and come back, you kind of got to go through a 14-day quarantine period on the way in again for all these people. So it has its own costs, obviously. If this XYZ theory is correct, after the first wave, continued lockdowns end up creating far more damage than the endemic virus itself. And what do I mean by the endemic virus? Endemic means it's just in your population, and there it is. So remember I talked about New York State, like I said, it seems to be over. It's not over. Look at this. There's a low level number of cases sort of continuing to chug along and burn through there. This is not zero down here at this end down here. There's actual positive cases. So it is burning through. These are actual cases. I don't know what we're at here, 500 or something. But it's quite it's a number. Hundreds and hundreds of people are getting this new daily COVID-19 cases. Some of them are going to progress to serious or die. Some of them are just going to have these so-called mild issues, which could lead to all sorts of chronic health issues. This is not, again, to minimize this and say, oh, it comes and it goes and then it's gone. It's not gone. But now you have to balance the damage that occurs down here with 500 daily cases against a lockdown or a set of economic restrictions which lead to stress, loss of income and livelihoods, all of which have their own terrible tolls, or just isolation, old people who can't see are isolated away from their family, who aren't allowed to see them because they're in an old folks home and where they've decided to implement, a no visitor policy, whatever. So these things all need to be managed. And so how we manage the loss of income, the loss of livelihoods, the stress, the isolation, all that stuff really is a balancing act. And there's not going to be any great answer. There's not going to be any this way is the perfect way that leads to sunshine and roses for everybody, because that's not the nature of what we're up against here. If the XYZ theory is incorrect, we're going to see a pronounced second waves. We're going to see these in all the countries with poor test and trace and containment abilities. New Zealand might not have a second wave at all because, if they, maintain their strict quarantine policy and they don't have any inbound cases coming in and they don't have any cases circulating endemically, then they won't see a second wave. They won't have it. But United States, we would have one. When would we expect that? What's the guess? Fall, right? Why? I don't know. It's the temperature, it's the weather, it's how viruses work. We don't know. So we're going to find out about this in the next few months, which of these things is whether the XYZ theory is correct or incorrect. So again, just being curious about it. Regardless of which is correct, the best approach, as always, is to be cautious. You got to be vigilant. You're going to wear a mask. You're going to tune up your immune system. You're going to eat well, sleep, find joy, live well. These are all things that we need to do, even though we've got this honey badger of a virus circulating out and around in our culture and in our communities. And because of all the countries that have managed to avoid that and have managed to pretty much really fully squash this, because we had an opportunity in Europe, in the United States, in every other country to just shut down travel for a period of time, halt the inbound infections, undertake a really aggressive test and trace and containment program, pay for people to be in quarantine so that they stay there. We could have done that, and we could have avoided all of this, and we don't have to be where we are, which means it didn't have to be this way. It really didn't. And it doesn't have to be this way either, with the Federal Reserve going out and throwing all this money at the rich people and pumping up the stock market day after day, because that's going to cause its own troubles, and we're going to regret that too. So here's wishing for better leadership, and here's wishing for more common sense to come back and come into our country and into our world, because we're going to need to do better if we want to have better outcomes. All right. Remember, if you haven't seen it before, this is my personal immune booster set. Any sign of illness, of course, elderberry syrup. This is my favorite brand here. Quercetin plus zinc allows that zinc to get into my body. And D3, although I'm getting plenty of sunshine right now, but certainly D3 is going to be really important for people who don't get a lot of sun for whatever reason. And for myself as winter and fall come on. N-acetylcysteine and vitamin C in case I do get sick and I want to damp that cytokine storm down. By the way, this is ascorbic acid is the A in the math protocol. So MATH, A is ascorbic acid or vitamin C. So that's something that's important too. All right, remember if you want to join the resilience movement and signify that to other people, get a t-shirt and then send a pic to info@peakprosperity.com, and we'll put your pic up into our Instagram page here. And that page is growing all the time. It's so great to see all you people wearing these shirts. And of course, get out there, harvest your garden if you've planted one, or visit your farmers markets. Make sure that you support those and get high quality food for you. By the way, great interviews about this stuff coming up. One with Joel Salatin will be released pretty soon. So look for that coming out on the channel soon. And otherwise, if you've been unsubscribed, remember to resubscribe. All right, that's all I have for today. We're going to see you next week. Thanks for listening, everybody. Bye-bye.
Hi, folks. This is Adam Taggart, Chris's co-founder at Peak Prosperity. To get your own Resilient shirt, simply go to peakprosperity.com/shirts. Each shirt is made of 100% organic cotton and produced in the USA. And when your shirt arrives, please send us a photo of you wearing it if you feel comfortable doing so. We'll add you to our wall of proud Peak Prosperity members who are showing the world that resilience is the way to a better future. Thanks for watching.